Okay, I'll just tell you. Basically, I'll tell you the. If you are comfortable in Hindi, also I am okay with that.
Both, sir, both.
Okay, fine. I'll just explain. The thing is actually why we do karyotyping and fish. This is the first concern. I'll tell you that many of the gynecologists and pediatricians and neonaticals, first of all, for if suppose for small example, if suppose somebody is going to be delivered within a 1 or 2 days, immediately after that, gynecology will go for surgery or something, and then immediately the pediatrician is a must. When pediatrician comes and checks the baby, and if he says that baby is fine, then it is good. Otherwise there might be a problem with the baby, it seems. Okay, so in that first case to be sent for karyotyping, that is the first criteria. For every sales people must be aware of that. From where we get a sample is, the first thing is when the baby is born, if it is an aborted or if it is aberrations. For next output also they will evaluate by the first result. And the second line is, if suppose somebody is I think getting married, and after marriage, if they don't have children or anything, any issues, everyone doesn't know that what was happening. Then immediately they will go for gynecology. That is the second line. And after going to gynecology, immediately there also the same will be happened. Even for gynecologists, will first of all they will tell that please have a karyotyping first, and then we'll look into further steps later. The first step is karyotyping, and this is the gold standard method in the whole world. Not only in India, the whole world, it's a gold standard method, the basic karyotyping. And the next step is, suppose if somebody is around 12 to 14 years, or any females or anybody, either male also, somebody will be having some problems before infertility also, some problems. Like example, I can tell you micropenis, or maybe for amenorrhea cases for females. Immediately the gynecology will refer for karyotyping, because they just want to rule out whether it is a 46 chromosomes or 45 or any 47 numerical or structural abnormalities. So first of all, everyone should be aware that we'll be having 46 chromosomes in our body. If suppose we are having 45 is also a abnormal, and if it is having more than 46 is also an abnormal pattern. This every sales must be having a knowledge on this. First thing, this is very important. And then next, after getting a samples, how we have to collect the samples is very important criteria again here. When compared to other departments, they will be having a sample with antibiotics also, there won't be having any issues. But for cytogenetics, you must be thorough knowledge that before taking a sample itself, you have to take care that the patient should not be on any kind of antibiotics for a period of 1 week before giving the sample. Please understand, this is very important. Before collecting the sample itself, you must explain to the client saying that the patient should not be on any kind of antibiotics for a period of 1 week. Example, if it is a paracetamol also, it will impact the cells. The cell will hinder. It won't be, I mean, the growth of from the blood sample, we cannot grow the cell culture. This is very important. And for babies, obviously, the patients will be on antibiotics for some times, but we cannot ignore the patient. But in that case, we can have a discussion with the doctor, because our report is a lifetime report. It won't be impact, like if suppose biochemistry or any other department, if you give a sample, the report will be released with 1 or 20 or 23 some values. But if we take again after 1 hour also, if we take the sample again, the reading will be increased or decreased. But in cytogenetics, it won't happen. It will be static. Like if we get a result once, the same result will be appeared. If you perform the same test after 10 years or 20 years or 50 years also, the same result will be appeared. It won't be having any changes. If suppose something is changing, then definitely both the labs or both the patients or both the client, everyone will be into a soup only again. We have to face from the same to client or doctor or anybody before collecting the sample. The patient should not be on any kind of antibiotics. First priority. And then coming to next thing is, when compared to other laboratory, I'm going into general, I'm not going for slide. Later I will explain the slide thing also. And Coming to second part is when compared to other laboratories, see in what way we are good, that also I will tell you, because the sales team must be knowing with our, because they used to defend with the doctors, they must defend with the doctors to get a samples, right? So I'll tell you, if suppose other laboratories, I don't want to mention any other laboratories, like xyz laboratories, they will perform karyotyping for just 1 week also, or 10 days also, sometimes very few labs, but the quality of the report won't be good. If you want, you can also have a comparison, because they won't give any recommendations or they won't give any interpretations properly in the report. They will straight away tell that it's a normal karyotype, normal male or normal female karyotype, but in our report we will recommend to the client through our report, saying that you have this problem, so you go for alternate test like this, and then you confirm the same. This is one most important in our standard reporting. This everyone should be having a thorough knowledge on this, because you must defend with the doctors also. And then one more thing is, if suppose whenever you are collecting a sample or whenever you are explaining the same to doctor also, if you have any difficulty in explaining also, you can always contact me then and there itself. Anytime you can call me. I will be answering the same to any point out. Only the thing is, when I was driving, I can't leave the phone. That is the only problem for me. Remaining anytime you can call me. Fine. Okay, then coming to our PPT, this was the basic things I just explained. And one more important I forgot. Whenever you collect the sample should be collected in sodium heparin vacutainer. That is a green top vacutainer, because in market we can able to find two green top vacutainers. One is lithium heparin and the one is sodium heparin, but I suggest sodium heparin is a perfect tube for cytogenetics, because in lithium heparin there will be some kind of anticoagulants available in the tube. So with that, when we add a blood sample to the lithium heparin, the cell will hinder the growth inside only. That we don't recommend actually. But in some cases we'll get as a culture in that also, but every time we won't recommend. Very rarely, if suppose some patient is having only lithium heparin, they don't have any other vacutainers at present, in that case we will recommend, but that too very rare case, that too discussion with me. After final discussion with me, then only I will accept, otherwise straight away the sample will be rejected. Okay, and now I'll come to the PPT presentation. See, this is just an overview of the test. See, why we do karyotyping is different. The test overview is just to identify and evaluate the size, shape, and number of chromosomes in a sample of a body cells. As I said very clearly, 46 chromosomes will be available in our body. 23 pairs with one sex chromosome. And it won't be like we can detect in our karyotype is, suppose there will be some kind of abnormalities like structural abnormalities and numerical abnormalities. Numerical abnormalities anyone can detect, like if it is a baby is having a Down syndrome, 47XXY will be XX or 47XY plus 21, an additional chromosome of 21 will be present in that. That is extra, like a numerical abnormality anyone can detect, but structural abnormalities are quite difficult to identify. And we'll get a samples with different cases, problems with a personal, like I said, a baby, neonatals, the developmental delay, there will be a problem. After immediately birth also, in 1 or 2 days also, there will be some kind of disturbances. The patient won't be in a good position. There will be some kind of disturbances with the patient continuously. In that cases also, the same will be forwarded to cytogenetics, because we can rule out any abnormalities from the parental segregations, whether it has been passed from parents to the offspring, like that. And why it is done, it is also very clear. Determine whether the chromosomes of an adult having any abnormal, as I said, the mother or father, if they have some abnormality, it will be passed on to the child. And whether the chromosome defect is preventing a woman from being pregnant. Yes, this is also happening sometimes. Sometimes, not only sometimes, many of the times, if suppose the parents is having any problems, then the baby is also affected, and with that baby she can't be able to reproduce. That in that cases the miscarriages will also occur with the same patient. In that case, again they will go to the hospital and again they will get the gynecologist reference, and then they will suggest for a karyotyping only. This is all small things only I just mentioned, just to overall have a look and determine the cases of babies birth defects and disabilities we can able to identify, to determine the appropriate treatment for some type of cancers. Okay, this one you can leave it, no problem. Cancer I just prepared in general the PPT. And identification of sex of a person by determining the presence of the Y chromosome is also we can able to identify in chromosomes. If suppose ambiguous genitalia, if suppose baby is born in a day or yesterday or maybe today, then immediately what will happen, if the sex of the baby is not clear to the doctor also, then the doctor will immediately recommend the sample for karyotyping, just to rule out whether it is a male or it's a female. This is very important, ambiguous genitalia. That's why I always tell our team to have a proper clinical history, because earlier we were not able to get a proper clinical history. But anyway, whenever we find an abnormal report, then immediately we'll find out with our sales team to get a proper clinical history. But I request every sales team to get a sample along with a proper clinical history. Or if suppose the patient is having any previous reports also, please scan and do share the details along with the sample and with TRF, because our report is lifetime report. If we have a proper clinical history, then we can identify the proper cause and we can give the same in our recommendations. Because once there is a problem in our karyotyping report, no one can do anything. This is for sure. We can't repair or we can do anything. It won't be possible in the genetical level. If suppose there is a problem, definitely we have to go for an alternate method only. Example, if suppose patient is having a 47XXY or any other problem, all of a sudden male candidate or any female, then they have to go for an alternate method like any adoption methods or anything. But they can't keep on trying for babies. This is for sure. And genetical disorder, these changes may be inherited and may not be inherited. Sometimes it's a de novo new thing. If suppose a patient couple is having a perfect condition with the genes also, the maybe the neonatal will also get a different kind of mutation, maybe de novo, nobody can expect. That is also possible. And identification of testing is simple thing. Developmental delay, as I told very clear, neonatal deaths, multiple congenital anomalies and amenorrhea for female cases at the age of 12 to 14. If they don't have any cycles also, again there will be a problem. And sometimes the PCOD diseases will also occur in a female. And the familial chromosomal rearrangement will also available in the parental segregations. And the family history is also sometimes important. If suppose I think this can like a consanguineous marriages, I think everyone has heard about the word in AP and South region, I think the consanguineous marriage will be more. So in here also there will be some kind of problems. And moreover, the female should have a 2 childs before the age of 30 only. Otherwise there might be a problem. I don't say that it will be in 100% abnormal, but there is the risk factor is more and more for babies. If the baby is having, I think the patient is having more than 30 years of age, female especially. So my advice is all females should get married before the proper age, and they should have 2 children at least before the age of 30. And there will be known familial history also. Sometimes if suppose the patient is having any translocations, 2 and 7 translocation is having in the baby, like suppose the parents is having 2 and 4 translocation, or 2 and 7 or 2 and 14, anything it can happen like translocation. The baby might get an abnormal or may not be able to get abnormal. This is also in de novo again. 100% there is no guarantee that the baby should affect. Sometimes it may cause, like the mother is having some problem. If suppose the baby is having male, it won't carry. If suppose the father is having some problem, it won't carry to the male child. Vice versa, it will happen. And suppose it is an amniotic fluid, parental diagnosis falling, like we'll get a sample like amniotic fluid also at the age of 14 to 20. Now it has been increased to 20 weeks. 14 to 20 weeks also we may collect the amniotic fluid sample. If suppose, I'll tell you one small example. The patient got aborted for the uh, first pregnancy. The patient got aborted, it seems. Then the sample should be tested for karyotyping. But I recommend, before going for karyotyping, they can also wait for next pregnancy and they can go for amniocentesis. That will be a 100% result, because the second time the baby is internally, the baby is available in the womb. At that time, if we collect amniocentesis, amniocytes, we can take the amniotic fluid and we can go for karyotyping the whole full complete set of 46 chromosomes. In that, we can able to identify. If suppose in that also they will be having any translocation or anything, then the baby can be demised immediately. Otherwise, they can proceed. That is the best suggestion from my side. Amniotic fluid is the best thing. When coming to clinical utility, I told very clearly it's all neurological problems, conjunctive and developmental delay for babies. I'm just given a basic clinical history details. On what basis, with that you can collect the samples, like azoospermia or amenorrhea. Azoospermia is especially for male candidates. Amenorrhea or primary or secondary amenorrhea or ovarian failure is for female candidates. History, mainly we'll get a sample for karyotyping is just for infertility or any abortions or any chromosomal abnormalities. This is again prenatal cases. As I told, amniotic fluid we can suggest. Instead of POC, I recommend only amniotic fluid is the best thing. I mean, why to waste money? That is my concern. But many of the doctors, they wanted to know that POC, with that POC they wanted to rule out for next pregnancy. It may happen again with the same or not. They wanted to confirm the same. That's why they will send the POC sample. And the limit. Yes, yes. No, no, no. No. One thing, actually, there is a problem. See, actually, NIPT is also good test only, but in NIPT also there won't be having any all chromosomes. In karyotyping, you can find out all chromosomes, but NIPT is again a costly, so no one will prefer for NIPT. In NIPT, anyone will prefer for only 13, 18, 21 X and Y chromosomes only. Majorly, patient will be having the major problems with any child is first 13, 21, 18 X and Y only. They will check only these chromosomes only, first of all. But if you go for karyotyping, you can find out all chromosomes with lower number of amount only, with low volume. I think very less amount. If suppose NIPT, it costs around 20,000 or 30,000, but karyotyping can be just for 2,000 or 2,500. Patient affordable is also very important, no? For every case, we can't recommend NIPT samples. Fine? Clear? This is just clinical. Yeah, please ask. You can ask me.
And Kishorji, if I'm not wrong, then NIPT is again a screening test, but this karyotyping will be a kind of confirmatory.
No. The NIPT is just a screening test to confirm whether they will be having any abnormal or not. But in that, you will be having only 5 chromosomes, only 5 chromosomes, not the whole chromosomes.
Yes.
But in karyotyping, you can able to identify the complete picture of the chromosomes with proper details. Clear?
Yes, Kishorji.
Yeah. And when coming to limitations, we do karyotyping with a G banding technique. We'll be having a number of banding techniques, but in a G banding, we can give a clear band resolution to the patient. I'll show you in the last slide. I have one band resolution also. See, many labs will, you can see every sales people, please find out with the other lab also. You just see the quality of the report. That is most important, because you are the one who can defend with the doctor saying that the quality of the banding, how good we are performing in Sander. That is the one good point actually. I'll show you in the last. Okay, in general, we'll have blood samples, and we'll be collecting the samples in a small, like with the sodium heparin vacuum. I had just mentioned, which I told you very clearly, that only I have mentioned in the limitations. There is nothing to do with this PPT actually. But anyway, I will just read into a sentence so that you will be having a knowledge. See, limitations. Karyotyping relies on G-band quality and resolution. In general, blood samples give the best quality chromosomes and therefore provide the best chance of detecting small subtle chromosomes abnormalities also in our samples. Chromosomes from another tissues, example amniotic fluid, chorionic villus, and POC, give poorer quality chromosomes. Hence, the risk of missing a subtle abnormalities increase. That's why I recommend karyotyping instead of this POC. Because if we go with POC karyotyping, for example, I will tell you the POC itself. Whenever we receive a POC sample, the sample itself will be contaminated with the blood. So in that case, when we perform with the analysis here in the laboratory, what will happen? The blood sample of the mother will also mix with the aborted fetus. In that case, we cannot able to identify the 100% result with the baby. So that's why I recommend, instead of that doing karyotyping, we can go with fish technique, where we'll be having a clear picture. That too within just 1 week or maybe 10 days. But if you go with the POC karyotyping, it takes around 21 days, and after 21 days, you may listen our answers saying that we tried our best, but it could not be able to culture properly. Then again, the doctor will be doctor will be panic immediately, and they will tell that instead of that, why don't you recommend us when we give a sample straight away? You can, why don't you tell it's a reflex to fish? So that's why I recommend I request all salespeople to whenever you collect amniotic fluid, it's fine, no problem. Amniotic fluid, either fish method or for karyotyping, 100% will get a result, no issue in that. But in chorionic villus and in POC sample, there might be a problem, because the sample itself will be a problem whenever the doctor will correct the sample. So in these cases, I request for chorionic villus, please go with CMA, don't go with karyotyping. CMA is 100% result. And for POC, go for reflex to karyotyping instead of reflex to POC is fine with fish method, but not with karyotype. Okay. And then coming to the next point, cytogenetics, association of clinical genetics. This one you can leave it. This belongs to a reporting pattern, and it should be also be understood to even a G banding karyotype can never exclude extremely subtle chromosome abnormalities at the limit of the resolution of light microscopy. Example, and in our G banding, what will happen? Whenever we go for reporting, we can able to identify up to certain level only. Not suppose. If it is more than 5 kb, we can able to identify the report. But if it is less than 5 kb, 5 MB, sorry, if it is less than 5 MB, we can't able to detect the abnormalities in microscopic level. In that cases, we will recommend the same to CMA or any other like fish methods. But we don't recommend with a G banding technique. This is one important point. And the laboratory adheres the national proficiency standard. Okay, this one is also okay, fine. We will maintain all the standards to release our report. And here, this is the workflow of the cytogenetics department. How the sample, see, we'll collect the sample from 2 to 3 ml is a minimum. If it is an infant, we'll recommend just 2 ml is also fine for us, but not always, depending upon the patient condition. And we'll just take out the blood sample. Immediately we'll add it to our media, and then after adding, it will go for culture harvest. Culture harvest, it will incubate for 37 degrees centigrade for 72 hours. And at 71 hour, we'll add colchicine to arrest the metaphase cells. After that, we'll go for hypotonic treatment just to bulge the cells, and then immediately we'll add fixative treatment to separate the nucleic acids and amino acids. nucleic acid and proteins, to separation of nucleic acid and proteins, not amino acids, separation of nucleic acid and protein from a cell. And then immediately we'll make with a GTG banding with a trypsin. After doing slide making, immediately we'll go and screen under microscope with the help of Leica Cytovision software. After analyzing, you can find out here one small round oval shape chromosomes. With that, we'll arrange with the karyotyping by using our applied image spectral imaging software. This is the overall workflow. How will you do? But I request all the sales team to get the samples. Like if suppose we have 2 or 3 days holidays, example I'm telling, if we have suppose Saturday and Sunday, any festival is holidays there, in that case I request sales team to collect the sample after third day or before the second day only. Why? Because from your side the transportation should not be a problem. You must send a sample. The sample should always reach the lab within 72 hours. Otherwise the cell viability will be decreased, and if we perform the karyotyping also, the cell culture won't be up to the mark. In that case also the morphology and banding pattern will be decreased to the patient. Sometimes we may request the patients to repeat the sample also. So I request everyone to follow the guidelines. Like samples, whenever you are collecting the sample should reach the lab for analysis within 72 hours. Only for blood, I'm telling. See, this is again important. Sample collection and types. We perform here only 3 types, like peripheral blood samples in cytogenetics department, amniotic fluid and POCs. Suppose it is a peripheral blood, I said sodium heparin green top vacutainers. Adults 3 to 4 ml, neonates is 2 ml. The sample should be, storage condition would be ambient temperature. And the rejection criteria is, if suppose sample is not sufficient, we may reject. And if it is beyond the 72 hours old, then we may reject the sample. But for amniotic fluid, it is different. The sample should reach the lab within 24 hours after collecting. And the sample should be in 15 ml torsion tubes with a screw cap centrifuge tubes. Or even sometimes if you don't have centrifuge tubes, like a torsion centrifuge tubes, in that case, what I suggest is there will be a plain red top vacutainers. You can collect in plain red top vacutainers also, but here it is a problem. But you have to collect many tubes, because we need to get a minimum 20 to 30 ml. So you have to, based on that, you have to segregate. You have to collect in such that many tubes. And when coming to POC, we always request to get a sample in only saline, not in formalin. This is very important. Please listen. If we receive a sample in formalin, the tissue will be hardened. We can't slice. We can't go for dissecting. It won't be suitable. So I request everyone please to concentrate on this. The POC sample should be received always in normal saline only. If when coming to sample, it may be a tissue, and the tissue sometimes what will happen, many of the doctors what they will do is, at the time of 5th month abortion was happened, suppose, then the baby has been terminated the month of 5th month, then the whole baby will be attached into one container and they will send the sample to lab. Please understand the criteria here. Please inform the doctors or inform the laboratory technicians to dissect then and there only, to dissect the tissues for 5 grams or just 4 grams, and then send it in normal saline. Don't send the whole baby. At the sample should be dissected from armpits or thigh, not from any other parts. Either armpit or from thigh, or sometimes you can have a placenta is also fine, but don't get the other tissues. Okay, this is very important. No. That is okay. If with normal saline, you can. Good question. With normal saline, you can add gentamicin. No issue. Clear? It's a good question. What is your name? Yeah. Okay. And the tag for our peripheral blood samples is 14 working days. I just mentioned here 14 working days, But at present, we are giving the TAT in just 8 to 10 days only. 8 to 10 days, not even working days. This please aware of this, because you have to explain the same to doctors also. And for amniotic fluid karyotyping is amniotic fluid karyotyping, I think I have mentioned here wrong. Karyotyping, amniotic fluid karyotyping will take 21 working days, not 12. It was mistaken by me. Amniotic fluid karyotyping will, and POC fish is also just 10 working days. And POC karyotyping, I request please don't take POC karyotyping, because many of the time it won't allow us to do proper banding also. Finally, after 21 days, we request doctor that saying that the sample has been failed in culture. So instead of that, I request everyone to go for POC fish only. Within 10 working days, you'll get the result. And moreover, we'll get a sample from all gynecologists, pediatricians, and diagnostics and IVF centers. If you have any contacts with IVF centers or any other diagnostics, please contact with the head of the lab person, and then discuss with Syed sir for getting a samples, because he is the one who deals everything. He knows all in and outs. Actually, Syed ji ko. ठीक है? Okay, and
Sir, can I see the previous slide, sir? One.
yeah, please.
No, this one, not this one.
Yeah, this one.
Sir, apart from heparin tube, we can use the red cap also, like plain tube.
No. For no. No, you are talking about peripheral blood or amniotic fluid or POC?
No. Peripheral blood, ma'am.
Okay, in peripheral blood, only sodium heparin is required.
Okay.
No other vacutainers.
Okay.
Why?
Because sometimes neonatal like small babies are there, they won't come like blood in 2 ml or 3 ml. They're very small, like under 2 kg weight, sir. But doctor is necessary to do the test, but they are in medication. Then at time what we do, sir?
At that time, I'll tell you. At that time, what you have to suggest to doctor is, this is our lifetime report, sir. You can wait for 1 more month or 2 more months or 3 more months, and then you can collect the sample.
Okay.
If suppose somebody is not understanding the concept also, in that case you can straight away share with the doctor contact number. I will discuss through you only.
Yeah, okay, sir. No issues. I will let you know.
Because many of the doctors nowadays, everyone is very clear, so nobody knows the things. Because I recently heard from many doctors after joining in Sandor, nobody knows that the antibiotic will play an important role in the culture failure. Most of the doctors doesn't know. Only senior people will be knowing. Junior people they doesn't know actually.
And sir, one more question is, sir, if we receive the blood to sample to lab, sir, then how many days it will take to that we know the blood is good or bad, sir?
Good question. This is also very good question. See, if we receive a sample today, example.
Okay.
Then immediately we'll go for culture, and within 1 week we'll communicate the same to all sales people if the sample has been failed.
Okay.
Within 1 week is the standard guidelines. No one will question on this also.
Yeah.
Because sometimes patients will be on antibiotics, and sometimes they will tell that you please have a try. If it won't work, then please intimate me. And then also some doctors will suggest us.
Yes, sir. Because I happened with one patient. Is after 12 days I got the result that blood is not. We need a fresh blood. Then again I went to doctor and asked him the patient baby is on medication. They said yes. Again we take 1 month gap and we take again sample. Again same happened. This is the 2 times happened.
No. Not only 2 times. I will tell you one example. Can you please mute yourself once? Yeah, I'll tell you one thing. Very recently, in Sandor Diagnostics also, I cleared one doubt to one patient, because the 4th time the sample has been received to Sandor Diagnostic, and still 4th time also we were unable to release the report for those couples. Then immediately they have contacted me straight away, and they asked me, sir, in what way we can get a result? Then I said, whenever 4th time you are sending a sample also, but nobody has communicated you saying that please don't use antibiotics for some time. But I communicated the same to the client, saying that you please stop the antibiotics medicines for 1 week and then send the sample. I'll challenge you that definitely you will get a result. Otherwise, my experience won't be suitable for this. I said very clearly, I told this answer to that client, and immediately he followed my guidelines and he has forwarded the sample. and immediately I have given the result within 1 week time. Clear?
Yes, sir. Clear.
So that's why I request all sales people, please aware that the antibiotic, if suppose patient is on antibiotics, please avoid the sample. Please try to explain the content to the doctor or patient and then collect the sample, because ours is a lifetime report. We can wait for 1 or 6 months also, we can wait and we can collect the sample. There is no issue in that. And sometimes what will happen, if you collect a sample in a proper condition also, there will be a problem in culture sometimes. Very rarely it might happen. Very rare. I have faced such cases, 1 or 2 cases in my 15 years career. Only 1 or 2 cases. For POC samples or amniotic fluid samples, there won't be any antibiotic impact. Only for peripheral blood, I am talking about antibiotic difficulties. Only peripheral blood antibiotics will play a very great role in getting a culture. No. Even if we have an antibiotics, you can stop. Even normal paracetamol also will affect sometimes. So better thing is to avoid all kind of medicines for a period of 1 week and collect the samples. I am 100%. I will guarantee you that the report will be released without any confusion. This part nobody knows actually. Sales people also, some will be knowing, some won't be knowing actually. This is the major part where you have to defend with the doctors. Many of the doctors will also be not able to understand sometimes, but question them in such a way that you must clearly explain the differences. Clear with this slide? Can I go forward? This is market competency. I have just mentioned.
Hello. Kishore, I have one question. Kunal here from Ahmedabad.
Yeah, please.
Yeah, as you said that we should not take a sample if the patient is on antibiotics.
Exactly.
So is this applicable only?
Come again. Is it applicable? Please come again. Hello.
Is it applicable on for all
Is
patients
it
like
applicable only
prenatal
for the
and
blood sample
postnatal?
or for the other sample also like yeah? So is this applicable? No,
No,
I'm talking about blood sample only or fluid or PH also.
no. I'm talking about only blood samples, not with the prenatals. Only for postnatal, I am talking. Postnatal only it will affect. Prenatals, definitely patient will be on antibiotics only. Clear? Clear?
Yeah, sure. Thank you.
Okay. Then I'm going to the other side. It's a market competencies. I just prepared a few laboratories name. Generally, TAT will be 14 working days everywhere, and sometimes majorly everywhere the TAT will be 21 working days, but we have reduced to 14 working days, and still we are giving it in 12 working days with good banding and interpreting the results with proper recommendations. This is saying about a standard diagnostics. In this part, we must defend ourselves with the doctors or clients. Many of the laboratories, as I told very clearly, if you can find out with other diagnostics, the report will be given within 10 days or sometimes 12 days also. But there won't be any recommendations, there won't be any interpretation results also properly. Only they will give that it's a normal male or normal female. They won't be giving any karyotype picture also. Nobody will incorporate into the report pattern. But our report says, see, this is a general dummy report. I just prepared one normal report. If our karyotype says it's a normal 46XY, we'll use the ISCN guidelines also, current guidelines. We'll use the current guidelines saying that this is the normal karyotype, and we'll recommend the result saying that in our PHS stimulated peripheral lymphocytes revealed a normal male karyotype with no structural numerical chromosomal abnormalities. And this is a normal thing. So as a part of the standard diagnostics, it's a generally genetical laboratory. So I mentioned for every recommendation, I mentioned genetic counseling. But if suppose there is a problem with the report, say example Down syndrome, I recommend thyroid profile as well as genetic counseling. Based upon the reporting pattern, different type of reports will get to release. In that case, based upon the different type of abnormalities, different clinical history with a proper clinical history, and different recommendations will be given. This is just normal, so I have not mentioned anything. This is just normal karyotype. One is normal and one is abnormal. I mentioned here example. See, this is the abnormal report for Down syndrome example. There will be one extra 21 chromosome in this. Like the chromosome pattern will be 47 XY plus 21 Down syndrome. Here you can see if it is an abnormal, I can clearly mention the results part. The cytogenetics analysis of PHS stimulated peripheral blood lymphocytes revealed a male karyotype with the presence of an extra copy of chromosome 21, that is trisomy 21, in all the cells coded and analyzed. This condition is called as Down syndrome. Individuals with such a condition have distinct features such as broad face, narrow, upslanting eyes, a long tongue with producing tongue. Other visible characters include short stature, small ears with a fold. But this part, no, what I am reading, folded helix and broad hands with a semen crease. Down syndrome leads to retardation and often disorders to the heart and gastrointestinal tract. IQ lies to in like in the borderline to moderate IQ range. This part nobody will give in the report. I challenge that nobody will give this part. Everyone will write up to here, like trisomy 21 in all the cells coded and analyzed. This condition is called a Down syndrome. Only up to this part they will give the report. In majority of the laboratories. Okay, this is what I want. Yeah, please. No. We have to give because it's already a blood sample. No, live birth, live baby sample only. No, there won't be having any. There won't be having any medical issues. Come again if you are not clear. No. I am talking about the postnatal. You are talking about prenatal. In prenatal, we won't give a sex chromosomal abnormality. Sex chromosomes. We won't mention sex chromosome. If it is 46, we will mention as 46, comma dash dash. We won't give. We won't mention sex in the like our reporting pattern for prenatals. Clear? Are you clear? Okay. That's all about my paper presentation, and I'll just mention you one small introduction with like suppose I'll brief you very few things like what type of sample type for karyotyping is sodium heparin vacuum. This you must be knowing very clearly. And TAT for karyotyping, our TAT is 14 working days, and the total chromosomes which are present in human body cells is 46. And clinical indications for karyotyping is maybe primary amenorrhea, infertility, or BOH, bad obstetric history. Anything it may happen. And when can we perform karyotyping means either it may be neonatal also we can perform, prenatal also we can perform. And if suppose we have a culture failure in postnatal samples, it might be because of on medications and antibiotics. Or if suppose the sample should reach the lab after 48 hours of collection, also it may happen. And lithium heparin also, if you receive a sample, it might be culture failure might be happen. And a sperm contains both X and Y chromosomes. And other thing is, what is the rejection criteria for POC samples? Means I told very clearly it's a formaldehyde. If we receive a sample in formaldehyde, we can reject. And if suppose the full baby fetus has been sent to the lab after 5 months abortion, the full baby will be sent to the lab. In that case also we will reject. And if the sample we receive in a leak-proof container, non-leak-proof container, we receive a sample in non-leak-proof container, in that case also we will reject. And the sodium heparin sample should reach the lab within 72 hours of collection. This is very important. And clinical history for every result is mandatory. for cytogenetics. Clear?
Yes, sir.
Hello?
Yeah, Kishorji, I have a question. Like, is there any difference between coupled karyotyping and normal karyotyping, or both are same?
No, both are same. The thing is actually, if suppose there is only a single patient, in that case you can go for karyotyping. If suppose husband and wife both are going for karyotyping, then you can recommend that it's a couple karyotyping.
Thank you.
Both are same. Both are same only, but in the price there will be some kind of negotiation, I guess, in couple karyotyping. For example, if suppose sample has been gone for culturing for a single patient, it is around example 2000. For couple karyotyping, it will be around 1800 per single, like that.
Got it. Got it, Kishorji.
Anything else? I'll share. I will. Yeah, Dr. Mayank ji will share my contact number with you, and with my email ID also. In the PPT it is available. He will share my contact number. You can feel free to contact me at any point of time.
Okay, sir.
Okay, fine. With this, I'm just closing my presentations and all. Thank you. Thank you very much. Thank you very much for everyone.
Thank you, Kishore ji.
दीपक जी, आपने कुछ रेस किया है, बताइए. सैयद सर.